Okay, everybody, we're with our patient Polaris. Hi, Polaris.
Hello.
We're not going to show your identity, but you give me permission to share your story with the internet, YouTube, and anybody else that wants to know, right?
Yes.
Okay, great. I can't help, I'm going to get a close-up. I've just noticed here that you have some sutures, and if you guys out there in YouTube world can get a real close look at this, what you'll see is this is a job that somebody has done for Polaris, where they've used vertical mattress sutures, which is actually a very good choice for this kind of wound. It takes all the pressure off of the edges of the wound. Same kind of sutures that I used on Grover, if you remember that video. Okay, so let's back up a little bit. Polaris, what on earth has happened to your leg?
I was in an ATV accident, and somehow it either landed on my leg or it something was in the water because we fell over when we were driving through the water.
Okay, got it. Got it. So you were actually on a Polaris.
Yes.
Huh. I wonder, because that's just like your nickname. Anyway, so you fell off of it. You were not the driver?
I did not fall off of it, nor was I the driver. I was the passenger, and we were in it.
Mm-hmm.
We just fell into a creek.
Did the whole Polaris fall over?
Yes.
The whole thing went over.
Yes.
Okay, so you didn't fall out. You just...
No, I
Yes.
had someone fall on me, and then something hit me.
How many days ago did this happen?
8 days ago.
Wow. Are you putting a lot of ointment on this every day?
Yes.
Yeah, that's why it doesn't look like it's healing very well. All right, I want you not to put ointment on this, and we're going to take these sutures out in a few days. They're not ready to come out today.
Yes, and the only thing that I have to add about the ointment is when I have not put a lot of ointment on it, it is very painful.
It hurts.
Yes.
Okay, did they give you anything for pain in the emergency room?
Yes, they did, but it kind of makes me sick to my stomach, so I don't take it.
Ah, so you need something for nausea too.
Well, not really nausea. I just think it's, it was too strong.
Oh,
You know,
okay.
it was Tylenol 3.
Gotcha.
And,
Yeah. Have you had any fevers or chills?
no.
Okay. And it looks awfully red around here. Did you have a lot of bruising in this area, or has this infection spread?
It was just diagonal like this.
I see.
Whatever hit me hit
That looks like,
in a straight line.
I gotta tell you, that looks like bruising right all in here.
Yes, and it's very, I have no feeling right here through about right here. And then most of my pain when I walk comes from here.
Did they x-ray you in the emergency room?
Yes.
They x-rayed your ankle and the leg?
Yes.
Okay. And so we're x-raying this again today?
Yes, I do have the x-rays here if you want to look at them.
Okay. I will.
But she said that
they said
since I
x-ray it
didn't
again
have a
if it's...
report, yeah.
Okay. That's fine. We want to check the ankle anyway again, so we're going to x-ray that again. And I think that with your wound here, did they put you on any antibiotics by mouth?
Yes.
They did.
Two different antibiotics.
Good. Which ones did you get?
I got Cefadroxil.
Good.
And
It's a cephalosporin antibiotic along with...
And sulfitamide.
Yeah. That's it. Sulfamethoxazole trimethoprim is what that other one is, but that's okay. We commonly call it Bactrim or Septra.
Okay.
Great. Okay, so thanks for sharing your wound with us here. We're going to shoot a quick x-ray to make sure everything looks okay underneath and inside the joints. I'm going to give you something different for pain and some nausea medicine, along with instructions to... I'm going to get you to stop putting the ointment on this for a couple of days, and then I'll take these stitches out for you, say, on Wednesday or Thursday.
And I want to add
Go ahead.
that the biggest problem and the biggest pain is the swelling. How long do you think the swelling is going to last? Because as long as I have my leg up, I can flex my foot and it's not painful. The minute I put it down, it just like runs down my leg like a burning sensation.
Sure.
And then my foot just blows up.
Well, let's talk about, you've actually got a couple of different kinds of pain that you're dealing with. One is the pain from the edema or the swelling.
Okay.
That pain is going to persist probably for a few more weeks.
Okay.
Because you're not going to be completely healed. Now, first of all, let me back up. We're presuming that our X-rays aren't going to show us that there's a crack or a fissure in the tibia or that you've got something more serious. Now, that's less likely because you've already got a set of negative X-rays. I'm repeating X-rays because your ankle looks so bad and you're still having a lot more pain than we would expect with this. Okay, so this is just more of a let's make sure everything's okay with the X-rays. They're quick, they're cheap, let's do them. So if the X-rays are all okay, then you really have two kinds of pain. One from the edema or the swelling from the wound itself and the contusion that you got. And the second kind of pain you described was a nerve pain or a neurogenic pain. So that's part of the reason why you've got some numbness over in this area is because you've damaged one of your cutaneous nerves to your leg here. And that's giving you that anesthesia along with some occasional sharp pains or electrical shock kind of pains. Okay, you guys can't see, but Polaris head's nodding up and down. Yes, that's what I'm experiencing.
Yes, it is.
Yeah.
It's very much a tingling, burning sensation, and it just runs down my leg in the morning or whenever I get up. So sometimes it makes me not want to put my foot up, even though I do want the swelling to go down, but then I have to pay for it when I put my foot down.
Right.
So it's like...
Okay, so I think we can help with that with something. I'm going to give you a prescription for a medicine called Lyrica.
Okay.
A low-dose medicine. It is a neuromodulator, and it helps with nerve pain. I think maybe a couple of weeks on it is all you'll probably need. Okay. And I might even have samples just to give that to you. Okay. And I'm going to give you something, like I said, something stronger, maybe not stronger, but something different for your pain and something for the nausea so that you won't have to depend on continuing to put a lot of ointment on this. And I think at this point, I'd like to see this healed up a little bit more before we remove those sutures, because I would really hate for this to open up. Okay, so I want to be sure this is really well healed, and the ointment is kind of disguising a lot of what I'd like to see in there. Okay, did you have a piece of skin that was missing? Did they have to pull this together tightly, or do you remember?
No, I did not watch the suturing. I couldn't do it.
You didn't want to watch it.
No.
Okay. Well, Polaris, we're going to get you better.
Thank you.
Thanks for agreeing. I know you didn't want to do this at first, but you did agree and to share your story. And I promise nobody except everybody on the internet will know who you are. I mean, nobody. I'm sorry. Nobody will know who you are. I wouldn't do that. All right. Thanks again.
All right.
Yeah, too much. It's baby Polaris.
It shouldn't hurt.
Just be gentle.
Okay.
Please.
I want to point out these are horizontal mattress sutures. These are really good kind of sutures for any kind of large wound because it takes the pressure off the edge of the wound. And it actually makes it a little bit more challenging to remove them, though. I'll tell you that.
Oh, okay. Yeah. That's very comforting.
Isn't that comforting? And here we go. A little kind of pull there. This is going to take some work. Gonzo, we may actually have to give her some rawhide to bite down on.
Be nice.
Oh, I'm just teasing with you. You know it. Actually, this is really dry now. Went from really wet to really dry, didn't you?
Yes.
Did it stop hurting?
Yes, it did.
Well, they're deep in there.
Weird. I didn't think.
Okay. So you got a lot. You have a lot of scab on here. We're going to stop and we're going to actually put some saline soaks on this and see if we can soften up this scab and make it easier to take these stitches out for you.
Okay.
See you in a few minutes.
Okay.
This is Polaris. Polaris. This is Gumby on the camera here.
Hi, Miss Polaris.
Ask your question. I am ready.
Okay, so now that some of the swelling has gone down,
yes,
I see that there's a lump right here. What? I don't know.
It's nothing to worry about. That's a contusion, and that will heal. How bad are you hurting right now? A little bit tender, huh?
Yeah, just a little. Not too bad.
And we're just trying to loosen up some of this dried scab material. You've been soaking now for about 20 minutes, right?
So, okay, now question number 2. I had a trip planned with Air Flight. Do you think with all of this being swollen, you think it would be okay for me to fly?
Well, that depends. Where are you going?
Portland, Oregon.
Oh, yeah. That's not exciting. If it was something fun, we'd say no. But Portland, yeah, you can. Oregon or Maine?
Oregon.
Yeah, you can go to Portland. That plane's mostly empty anyway, I think, right? Sorry, people in Portland. I'm just kidding. Portland's a beautiful city. Very diverse, eclectic population of beautiful people.
Okay, I'm
Are
gonna
we
lay
ready?
down because I'm not watching.
So what happened
this.
here?
Oh, Polaris, tell her the story.
Oh gosh. Okay, so we were on I guess it's like a 4-wheel ATV.
Did you see that?
A Polaris.
Yeah, it was a side-by-side, wasn't it?
Yes.
A bigger one?
Side. And we were going through Cypress Creek, and we hit a spot that was a little too deep, and we tipped over. And when I got up, I had a big cut.
Let's call it a gash.
leg.
It was a
Yeah.
gash, wasn't it?
Yes, big gash in my leg, blood streaming down. Yeah. I
You didn't
guess-
pass out, did you? Okay, great.
She also didn't look at it, did you?
No.
I wouldn't have either.
No, we wrapped a t-shirt around it on the top of my leg, and we oh,
Sorry.
ow.
There it is right there. I cut that one off, so I got it.
Okay.
Yeah. These are a little more difficult to get out when they've been in as long as this one. Part of the reason was because we sent you back the other day.
Yes.
Yeah. So I knew this was going to be a challenge when you came in. When you came in the first time, I said, it's going to be a tough one.
Yeah.
So I'm just taking it slow. That's why we did put the saline on here to kind of soften up the scab so that we could work around it a little bit. Yeah, this is a pretty significant gash, and I know that's a little bit tender there, and I apologize, but I've got to kind of work some of that scab out of the way so I can get to the stitch to cut.
Oh,
Yeah,
that's lovely.
that's exciting, isn't it? Gumby, what have you been up to lately? We haven't talked to you in a little while.
Man, the lab has had me busy.
They have had you going, haven't they?
And you, all these physicals.
Yeah, we've been really with all our routine stuff today, haven't we?
Yeah. And yesterday. I missed out on the procedures yesterday, too.
Did you? Yeah, you did yesterday. This one's playing hide and seek with me, but I know where it is.
Yeah.
It's right there. I know there's a stitch in there.
Oh gosh.
You okay? Hang in there. If it hurts, you tell me.
Okay.
This is one of these situations where every doctor is like, oh, I don't want to dig and dig for something in here because it's going to hurt, but yet I know I've got to get that stitch out of there. Let's move to a different one, and we'll come back to that in a minute. Maybe it'll heal itself, right? Maybe that stitch will jump out all on its own.
I can hope.
These were put in really tightly because you had so much swelling and such a big gash. There you go. That one came out pretty easy. It's hard to pull them back out. That one came out well too. That's good. This one I hope will come out pretty easy. Right there it is. So yeah, I think you can take a trip, and you're still going to have some swelling for a while. It'll take a long time for all this swelling to heal, but it will. So don't worry about it. You know, hey, there's more going on here, and why isn't this healing, and those kinds of things. These things just take a while to heal sometimes.
Okay.
You're doing good, Mom.
Did you feel a little sting that time?
Yes.
I'll go to a different one for a moment. There it is. We can blunt that one just fine. We are down to 2.
Okay.
All right.
Good.
Isn't that good? Sometimes I think it'd be easier to just untie them. Aha! Got that one out good.
One
You
more?
got a little bleeding there.
Yeah, one more.
We just have one more. Yeah, that was a deep one. See that one? I pulled that stitch out. It bled.
Ouch.
You okay, honey?
Yeah.
Are you okay, Polaris?
You're doing good.
Please.
All right. I think we're all good. We're going to put some steri strips on this for you. I know we have one more in here. I can feel it. That's good, that's good, that's good, that's good. We're good over there. So we have one more hiding right in here. And I just felt it right there. Either that or it's a hair.
Okay. Well, there was 9 stitches. Did you pull out 9?
Well, now that information would have been helpful at the beginning. Yeah, we've got some eschar here. Eschar is basically just some dried up dead skin that's covering. That stitch is in there. I know it is. I will not be defeated by this stitch. What do you think, Gumby? What are the odds now? What's Vegas saying on this last stitch?
How many did you pull out?
12. This reminds me of hunting for a toothpick that we did last week.
Oh, that was awesome.
Yeah. We had a fellow came in last week. He had a toothpick that had been in his leg 5 years. Oh, looky there. It is right there. We found what we were hunting.
Thank God.
So now you are stitch free.
Oh,
well, now we're done taking stitches out, yes, but I'm going to put some steri strips on you.
Okay.
Gumby, keep rolling. Let's let everybody see what the steri strips are.
All right.
Well, if we had some, it'd be nice.
I think it's in the second drawer.
Is this drawer?
That one.
Yeah. This is tincture of benzoin. This is a sticky stuff that we like to use to hold steri strips in place. This is what the clowns in the circus use to hold their rubber noses in. It's important when you're putting this on that you don't get it into the wound because it stings a whole lot. Patients will not like it if you get it in the wound. Just a little warning for all of you out there that are thinking about learning how to put steri strips in place. Steri strips are actually real easy. It's not complicated.
So, you know, not getting this wet when I shower. Should I put something over it? How do I care for these?
You're just going to let this stay nice and dry and stay covered. Think of the steri strips really as smart strips because they're smart. They'll know when to come off. They'll come off on their own. You don't have to take them off.
Okay.
Okay? And this will give the wound a little extra strength and protection so that it doesn't open up.
Okay.
There, right? Don't need those. Now you've got 8 steri strips, but you don't have to keep track of those. Okay. So next thing we're gonna do is we're just gonna put an Adaptec on there, which is a non-stick dressing. We'll do a little wrap for you, and you're gonna be good to go.
Okay.
Polaris, do you have any other questions for us?
So I don't need to do anything with these. I just leave them on and
let them fall off when they're ready. They'll give up and they'll let go of you when they're finished doing their job. They know when. All you have to do is just keep this dry and covered. Don't put ointments on it like we talked about. And this will heal up just fine. Once it's completely healed, then you can start using the scar cream we gave you.
Okay.
Okay. And how are you doing with pain medicines and stuff like that? Are you okay?
Yeah.
You're good?
I think I'm
All
good.
right. You did really well.
Thank you.
Thanks for letting us share your sojourn with YouTube and the internet. Gumby, thanks for being a pal and recording.
You're welcome.
Did you get a close-up on that railroad track?
I did.
Yeah, I think that looks great.
It does.
All right, guys.
All right, bye, guys.
Okay, let's go.
It has helped me so very much with working. It gives me a lot more energy throughout the day, and instead of being in the middle of the day, I can get through my whole day, and it's been working really well.
Takes away that afternoon brain fog,
Yes,
doesn't it?
it does.
Great.
It's been great.
Great. Fantastic. Thanks.
You're welcome.